Hi, my name is Jade, known around the web as Backline Nurse, and today I'm going to talk to you about the top 10 things that you need to know about a potential COVID-19 vaccine. If you're like me, keeping up to date with what's going on with the pandemic is stressful. And sometimes you just want to shut it off and be like, there's nothing I can do about it, and it seems like this is going to last forever, so I'm just not going to think about it. I totally get that. I'm guilty of the same thing. But I'm here to tell you today that there are good things happening. We can see the finish line, but we have to work together to make sure it's not going to keep getting worse before we reach that point. So, something that I like to do when I'm stressed out is watch YouTube makeup tutorials. It's like, I guess, kind of like ASMR. What is ASMR? Hold on. Okay, I don't really think that applies, but I put out a really short video just for fun on Twitter the other night talking about this vaccine while doing my lipstick, and people really liked it, and it was also really calming to me. And so I feel like maybe it'll be a little bit easier to listen to these scary things that we need to pay attention to while you have something relaxing to look at. I don't know if I'm relaxing to look at, but maybe makeup will help. I don't know. So anyway, this is not a tutorial. I am not great at makeup. I might not even be good at makeup. And so feel free to make fun of me. Feel free to give me tips on how to get better. I'm kind of seeing this as YouTube teaches me how to do makeup. Well, I can teach you how to keep yourself safe. All right, let's go. Please stay till the end because I've got some hopeful things that we can look forward to and an assignment for you. So I haven't had my eyebrows done since the pandemic started, and they are a stone cold atrocity right now. So just like cut me some slack. We should all be cutting each other's eyebrows some slack right now. Top 10 things you need to know about a potential COVID-19 vaccine. Okay, so number 10, this is the fastest a vaccine has ever been developed. The next fastest in line, just to give you some perspective, was mumps, and that vaccine took 4 years. So I know you're probably thinking, that's really fast. It's probably not safe, right? Which brings me to number 9. I spilled my water bottle. This is why staying hydrated is bad for you. So the way that they did this was not by sacrificing safety or oversight. What they did was have many steps that are usually occurring in a stepwise process occur at the same time. So the risk involved with that is not a safety one, it's a financial one, because agencies are investing a lot of money. They've chosen the top candidates for the vaccines that are most likely to get approved and have started mass producing those so that when they do get that emergency authorization to distribute the vaccines, they'll be ready at the starting line, ready to go. You may be wondering, who is funding this? Who? Well, there is this program called COVAX, which is the vaccines pillar of a larger effort to stop coronavirus worldwide. It's led by 3 organizations, which I'll put on the screen here, and 156 countries all across the world agreed to be part of this effort to split the financial risk between those governments to ensure that a vaccine is made as safely and quickly as possible to deliver to the rest of the world. Was the US one of these countries, you may ask? No. I believe China was the only other industrialized nation to not join this COVAX effort. So it's really remarkable, this international effort to get an effective vaccine, to get a safe vaccine, and then get that vaccine out as quickly as possible to the rest of the world. And they're not just doing this for vaccines, they're also doing this for therapeutics, meaning like medications and treatments as well. Number 8, there is a potential COVID vaccine that could be distributed as early as next month, December 2020. Ooh. No, stop. We're not celebrating yet. I gotta tell you about it first. So this vaccine was made by a pharmaceutical company you may have heard of called Pfizer, and a medical engineering company, I think that's what they are, called BioNTech. BioNTech and Pfizer have been working on this vaccine since April of this year. They had worked together previously on various vaccines such as influenza, and so they already had a working relationship, and they already made a deal to work on it together in April. The primary funding for this vaccine that they developed came from the Berlin government in Germany, because that's where BioNTech is based. Which brings me to number 7. The United States government did not fund any part of the development of this vaccine, in spite of what some people are saying. What the US government and Operation Warp Speed did do was vouch to buy a bunch of doses once a vaccine is approved, kind of so the US would get to decide who gets it first. Sorry, rest of the world. Okay, back to this vaccine. It has a 90% efficacy rate. Let me tell you what that means. This means that one trial group got the vaccine, one trial group didn't get the vaccine. The ones that did get the vaccine showed a rate of COVID-19 90% less than the group that didn't get the vaccine. And that, my friends, is a really high efficacy rate, and there is reason to be excited about it. To give you some perspective, the flu vaccine generally has an efficacy rate of about between 60 and 70% depending on the season. Number 5, this vaccine from Pfizer and BioNTech has not yet been tested on children under 18 or pregnant women. Oh Lord. If any makeup people are watching this, I know I'm stressing you out so much with how terrible I am. Look, I never claimed to be good at this. In fact, I said exactly the opposite. You're getting exactly what I was selling you, so that's on you. Did I say the last one was number 5 or number 6? Either way, we are on number 4. There have been some short-term side effects noted with this vaccine, including sore arms, muscle ache, headache, kind of similar side effects you'd see the day you get a flu shot, except they're noting that these effects from the COVID vaccine can last a few days and are a little less mild than the flu vaccine side effects. What we won't know for a little while are the long-term side effects. However, I do have something reassuring to say about that. I recently watched an interview that Dr. Gaber Kellen, who is the director of emergency medicine at Johns Hopkins, did, and he said that generally with a vaccine that makes it to this phase of development, you'll see any adverse effects that are going to happen by the 2nd month. This vaccine trial has passed that point, so still reassuring. I probably look bananas on camera. It's probably really bad. Just bear with me, folks. Yeah, this is horrible. You can feel free to make fun of me. I do it all the time, so. Okay, I'm usually really good at a wingtip. I'm using a different product than I usually do because I ran out and the other one's too expensive for me now, so here we go. Ta-da! This one, on the other hand, is the worst one I've ever done in my life. I just don't think there's any way to salvage this little gal. Oh my god. I'm just gonna keep making it bigger, see what happens. Just the same mistake, but larger. Whatever. What matters is my heart is pure, okay? Number 3, the Pfizer and BioNTech vaccine requires 2 doses to be effective, 21 days apart. Some would also call that 3 weeks. It will not reach that maximum efficacy until 7 days after your 2nd dose. So number 2, we're getting there, people. What am I doing? We just don't know. There will be 50 million doses available worldwide if this vaccine gets emergency authorization. But because you need 2 doses for it to be effective, that means only 25,000 people are going to be able to get it on the first round of distribution. Dr. Fauci has said in an interview recently with CNN that if he were to estimate, here in the US, we could have everyone vaccinated by April 2021. Okay, let's talk. So that's all extremely good news, right? There are other things that we can be hopeful about as well. Number 1, we're gonna have new leadership soon that will hopefully take this a lot more seriously. Number 2, we know more now than we ever have about this disease. People have been doing research all over the world for the past year, figuring out vaccines, treatments, precautions, all of which can help us get through this safely. So we can see the finish line on the horizon, right? So it's more important now than ever that you don't give up. I know that holidays are coming up and people really want to travel to see their families, and I do too. And I'm not going to tell you what to do about that because I understand that it's easy to look at this and feel hopeless because many of us have been quarantining and doing what we're supposed to do and the virus is still winning. So you might feel like, well, what's the point? I might as well enjoy my life because nothing that I do is making a difference. But right now it's different than before. Things are getting worse as far as cases and hospitalizations and deaths in the United States. A prediction model at the University of Washington has predicted that if things continue the way that they are right now, by mid-January, the US will be seeing more than 2,000 COVID-19 related deaths every single day, and will have reached a death toll of 440,000 by mid-March. But there's still time to change the course. And now it's different because we have that finish line on the horizon, right? If we just keep our heads down and do what we gotta do, we will get there. there. It's there. We know it's coming, but it's gonna suck for a little while first. There will likely be more lockdowns coming from your state governments, depending on where you are. We need to be following those regulations, wearing masks, washing your hands, social distancing. But something that's just as important as that is being careful about sharing incorrect information online. It's never been easier in our lives to share information, which is really cool because it's how I'm able to sit here and talk to you right now. But also that means it's never been easier to spread false information. And just like any other public health intervention, it does not matter how effective a vaccine is if people don't want to take it out of fear because of misinformation. The information that you share with other people in your life and online could literally mean the difference between life and death at this point. We can't just be taking advice from somebody who shows up on our screens at face value. Uh-oh. You already messed it up. Oops. Who the hell am I and why are you listening to me? That was a trap. I walked you right into it. I'll put my credentials on the screen. But when someone's telling you about news that can directly impact your health and safety, you should be asking yourself, who is this person? What is motivating them to share this information with me? Why does this person deserve my valuable time and attention on such an important topic? Do they actually care about my safety and the safety of the public? Or do they have some sort of bias? And lastly, where are they getting their information? Is it first person? They're a doctor or a nurse in the field that's seeing this every day? Is it a public health official that's looking at all the available data and evidence all the time? Is it a news organization that's known for some sort of bias? You should not be taking my word or the word of anybody else at face value. Understand where they're getting their information. I'll be leaving links to all of the sources for the things I talked about in this video down in the description. Please check them out. I'm also going to leave links for some tools to help you figure out what's credible, what's not when you're hearing news from someone. Your best and most reliable source of information is going to be the World Health Organization, COVAX, and the CDC in the United States. If you take anything away from this video, I want you to take away, number one, eyeliner is hard. Just don't look at her on this side, okay? She's out of commission. Number two, news organizations that you trust to give you information that affects your life need to earn that trust. And number three, the finish line is in sight, but it's gonna get harder before it gets easier. We just need to do what we need to do to keep ourselves and each other safe in the meantime. Thank you so much for watching my video. I hope you found some useful information. I'm aiming to do videos twice weekly. Let me know what you thought about watching makeup while I'm talking, or if you would prefer to go back to the old-fashioned route of, I don't know what the old-fashioned route is because I've only done 2 videos, but let me know what you think. If you have makeup suggestions, let me know that too. Shit is hard, man. I also have a Patreon I'll put the link to in the description. And since I'm not able to monetize any of my videos yet, I'm gonna put my tip jar up on the screen. Boop. If any of the information that I've put in this video becomes outdated or incorrect as time goes on, I will be sure to put a note in the video and the description. Leave me a comment, tell me what you liked. If you have things you didn't like, that's fine. Just be nice about it, please. Please like and subscribe. It helps me out so much. I'm here to help you guys figure shit out. So tell me what you want to learn about. Be safe, be kind. Till next time. Sometimes I like to play which one of my moles is gonna kill me one day. Lay it down. Bronzer is really hard and I'm so white. Oh! Oh, catastrophe. You may be wondering, Jade, what are you doing with your makeup? Your guess is as good as mine, my friends. And we're blending. And we're blending. Oh my god. Blend, you son of a bitch. Oh, fuck. It's like the opposite of ASMR. Like, this is what you watch when you want to get stressed out more. I think we can all agree that I've made a mistake. Help!